Identify the limb reduction surgery in lymphedema. 4 options are there: HOMANS, Thompson, Charles and SISTRUNK operation. So this answer for this question is Charles procedure. Okay, we will go to the discussion, then you will understand why Charles is the procedure. Okay, so there are four named surgeries are there in limb reduction surgery. Just now we have seen in the option SISTRUNK, HOMANS, Thompson and Charles. The limb reduction surgery ideally useful in cases of lymphedema where you can reduce the size of the limb. So it is, but it is not a cosmetic surgery. It is to reduce the lymphatic tissue so that the patient can have the mobility will be there. So that is the idea of doing the limb reduction surgery. So number one is a limb reduction surgery is a SISTRUNK operation. So where you will take a skin, and along with the subcutaneous tissues, and that has to be excised completely and that has to be closed primarily. That is called SISTRUNK operation. And second one is the HOMANS operation. Here you can do, particularly in the lower limb, you can do it in the medial aspect as well as in the lateral aspect. So what you have to do, you take the skin along with the subcutaneous tissues completely on the lateral aspect, and you should give a period of at least 6 months, because so if you want to do on the medial aspect, at least give 6 months, and then after that you can do it in the medial aspect, because the main disadvantage of this HOMANS procedure is flap necrosis. Okay, so to avoid that one, you have to give at least a minimum of 6 months time. Then other surgeries like Thompson's. Okay, you see in this picture Thompson's reduction surgery. So here this is just a cross section of the lower limb, where you can see in center aspect you can able to see the bone is there, then followed by deep fascia, then subcutaneous tissue and skin is there. So first you have to raise the skin flap. So here you are raising the skin flaps, then you take the subcutaneous tissues and lymphatic tissues up to the deep fascia. Then from this skin flap you have to take out the epidermis, that is a shaving of the epidermis, and this flap has to sutured with deep fascia. Okay, and this flap, the second flap, has to close over this flap, and this is called a buried dermal flap. Okay, buried dermal flap. So the main disadvantage of this procedure is pylonoidal sinus formation. So that is the main disadvantage. Okay, next we are going to discuss about the Charles procedure. Here you are going to take, you can see that the whole lymphedema, you can take all the lymphatic tissues, that is you can take the skin, subcutaneous tissue, lymphatic tissue, and even deep fascia also you are going to take. So after taking the deep fascia also, you can able to see like this, then that has to be covered with the skin graft. Okay, so that is the Charles procedure. The only disadvantage is it gives a very poor cosmetic result. So that is a main disadvantage. The advantage for the surgeon is you can take maximum amount of the bulky tissues. So that is the advantage. So this is about the Charles procedure.